I'd like to acknowledge the traditional owners on the land in which we're meeting today and pay my respects to elders past, present and emerging, and to any Aboriginal or Torres Strait Islander people that might be with us today. I'd like to extend a warm welcome to Dr. Natalie Winter. Dr. Winter is a Senior Research Fellow at Deakin University who has a background in nursing. She completed her PhD in 2019, which explored the feasibility, usability, and acceptability of a smartphone app for informal carers providing support to someone with colorectal cancer. She continues to work on projects developing technology-based resources for people affected by cancer, including rare cancers, and for people from priority groups in Australia. Natalie's work partners with the Victorian State Government, national consumer groups, hospitals and universities to provide resources to people across Australia. In this session, we'd like to introduce you to the iCare study. The iCare study is testing the utility of a website called iCare that provides you and your family support person with access to tailored information and resources which you may need while living with a cancer or after finishing treatment. In our study, you may be selected to test iCare and provide us with feedback about the website. Over to you, Natalie.
Thank you so much, Alison, for the introduction and also for having me here today. It is a privilege to be able to present to you and tell you a little bit more about the study. So I'll just share my screen with you. And I have some slides here for us today. So as Alison mentioned, we are testing at the moment a study or a website called iCare, and it's an interactive website to improve health and well-being for people living with upper GI cancer and also their informal carer. So as Alison mentioned, my name is Natalie. I'm the project manager, and that involves speaking with people, seeing if they're interested in the program and also helping them complete the program. The project is led by Professors Trish Livingston and Vicky White, and we do partner with Pancare on this study. So I would also like to begin by acknowledging the traditional custodians of the land on which we meet and acknowledge any Aboriginal or Torres Strait Islander people here today or who may tune into this video later on. So first to begin with, I'm going to tell you a little bit about what iCare is. So it's a website that we've developed and we have developed with consumers along the way. So there is a lot of evidence behind this, speaking with patients, speaking with carers about what they really need in a website to help them while they're living with cancer or after they've finished treatment. So we've come up with this end product called iCare, and it provides patients and informal carers with access to information, resources, and health and wellbeing support. The content is tailored to each person's needs and also tailored to the specific type of cancer that they're living with. We also include other functions within the website, like symptom and pain tracking diaries. And again, these have been developed in conjunction with our consumers to make sure that we're really capturing and measuring what people are experiencing. People who are registered in the iCare study, they receive weekly emails and they share with people information that is available within the website that they may not be aware of. So people can jump into the website with one idea in mind of things that they would like to look at. And we just want to let people know about all of the other things that we also include in there that they may not have accessed yet. And the reason behind us developing iCare is that we do know that it's hard for people to know where to go to access information. And in particular for rare and less common cancers like upper GI cancers, there's not a lot of information available, and it is quite time consuming and onerous for the patient, the person living with cancer, and their carer to be able to find the resources specific to what they need. So that's where the idea of iCare has stemmed from. So as I've mentioned, iCare is also available for informal carers. And what we mean by this is family, friends, neighbours, or colleagues who provide physical, practical, or emotional support to someone living with cancer. And we know that our informal carers often experience their own health and wellbeing needs, in addition to needing information related to providing care to the person with cancer. So, iCare provides them with access to information specific for their needs to help support them. And also, they have access to the patient portal, and that provides them with all of the information available to patients to let carers know what kind of support people may need and the skills that they may need to support that person at home. So we do have a patient and a carer portal, and this is an example of what the main menu screen of iCare looks at. So this is specific to pancreatic cancer, and this is the carer's login. So they are slightly different. So we can see here there's these two tabs up the top, one's for carers and one's for patients. So this is on the carers tab. All of these different icons are things that are related to support for the carer. They also have access to the pain and symptom history that patients may enter. Uh, if we flick over to the patient view, which unfortunately can't do at the moment because it's an image, they have the same icons here, but for people living with cancer, it is specific to what they are experiencing and what they need. When we're looking at the pain diary and the symptom tracking diary, patients can choose to upload information if they would like, and they also have the option to share it with their carer, or they can choose to not share it if they prefer to keep it private. There is also the capabilities for them to download that information and take it to their clinicians at their appointments. So they have that history of how they've been feeling. They don't have to record it in multiple places, and they have all of the numbers in there, everything ready for them to go. So with our study, iCare is the first of its kind tailored website, and we're investigating the feasibility and acceptability of the program. And we're doing also some preliminary analyses on patients and carers' well-being. We are hoping to recruit 162 people living with cancer and also 162 carers. So we'll go through the eligibility criteria. So patients are eligible if they're over the age of 18, have been diagnosed with esophageal, pancreatic, liver, stomach, or bile duct cancer. So what we refer to as the upper GI cancers. They have been diagnosed with a stage 1 to 3 cancer within the last 12 months and live in Australia and have internet access. Carers looking after someone and supporting people who meet the criteria above are also eligible. And we have designed the program so people living with cancer and their carers can enroll as a couple, but they can also enroll independently. So sometimes one person may not have the time or may not be as interested, but the other person can still enroll and see how they're enjoying the program and contribute to research that way. So if people are interested, they go onto our website, which we have the QR code and the URL address there of our website. And it does have more information about the study and what we ask for people to do. And they can register. When people register, we ask them to do a screening questionnaire, and that's a really brief few questions, just learning a little bit more about their diagnosis to make sure that they're eligible. After people have completed the screening questionnaire and are eligible, they're automatically directed to the first questionnaire of the study. And it takes about 10-15 minutes to complete, and it's just letting us know how people are feeling at that point in time. After people complete the first questionnaire of the study, everyone's automatically randomized into one of two groups, which I'll go through more on the next slide. Throughout the study, we ask for people to complete another two surveys. One is 3 months after registering, and the last survey, is 6 months after registering. And again, they're online. We send people the link to the survey in an email, and they take about 10-15 minutes to complete. So when I'm talking about the two groups of the study that people are randomized to, we have Group A and Group B. So people allocated to Group A, they receive access to iCare straight away, and we observe what they do over a 3-month period. So they can use it whenever they would like to, as often as they would like to, and they can jump into whatever section of the program is relevant to them at that point in time. So it might be if people go for an appointment with a doctor and the doctor gives them a whole lot of new information, they might say, oh, not really sure about that, I want to look it up, and jump in then. So it's really flexible for whatever they need. People in Group B, they receive access to iCare at the end of the study. So that's the 6-month survey. In that time while they're waiting for access, they can access anything that their healthcare team suggests to them. We don't ask them to restrict any other things that they want to use. We know that that 6-month group does have a little bit of a wait to access the program. The reason that we have these two groups is we need them as a comparison group so we know if the program is useful for people living with cancer and their carers. So it can feel a little bit like the people in Group B are in a little bit of a waiting room there, but they provide us with so much valuable information, which lets us know if our studies are helpful for people. So the types of information we collect from people, we ask people to complete questionnaires, and they are related to your mental well-being, how often you may visit your healthcare team, and if people have access in that first group, we ask them if they have any feedback on iCare for us on how we can improve it going forwards. We also, in the background, collect data from people that have used iCare, and it's just some really basic information about how often people have used the program, which sections they've used, and how long they use the program for. And that gives us a lot of information about whether the type of information we're putting on there is relevant and whether people like to engage with the program. So at the moment, we have 53 people registered in the study. So it's 43 patients and 10 carers. And we are recruiting currently through the Pancare Foundation, the Upper GI Cancer Registry, and social media. And part of the reason for me coming here today to present to you is to hope to introduce the study to more people, let them know what it's about, and really give people the opportunity to ask questions to see if this is something that they may be interested in. So before we finish up, I would like to take a moment now to ask if anyone has questions about the study, or Alison, if you prefer, I can hold off till the end.
No, perfect timing.
All right, go for it. If anyone has questions, fire away.
I did have a question. I noted in the selection criteria it was noted said specifically stage 1 to stage 3. Is there a reason that you chose not to include stage 4 diagnoses or carers in the study of this?
Yeah, that's a great question. It's one that we often get. So one of the reasons is that because people who have stage 4, we have heard from them that it is a period of high stress. They've got a lot going on. They often feel they don't have the time to participate in research, but also because we do ask for people to complete questionnaires, we do follow up with people if they haven't completed questionnaires. When they're in that stage 4 where there's a lot going on, it's something that can be a little bit of a burden. So for this study, we have excluded them, but we are looking at future studies where we could test it with people with stage 4, because like they do have their own unique needs as well. It is a period where they need a lot of information and a lot of support. So we are trying to think of other ways that we can deliver programs like this. So they're not a burden so much, but they also are providing people with a resource. Does that
Thanks.
answer your question?
No, that's great. I figured that was probably the reason anyway, but it's always good to know. Yeah.
Yeah,
Thank you.
no, perfect. Thank you so much as well for bringing that up.
That's all right.
I have a similar question, Natalie, about the recruitment of people that have been diagnosed within 12 months.
Yeah, perfect. So when we've been developing the program, we've done a whole lot of other little studies that have led to this. And what those have showed us when we've talked with carers and people living with cancer is that they really need information at diagnosis when they have all of these questions, when it's something that they need the most amount of support to try and figure out what's happening. So because that's the information that we've heard, we really wanted to focus on that group because the information and needs that people have does change over time. So we wanted to look at that first group at diagnosis to see if we can support them during that time.
Thank you.
You're welcome. Any other questions? Alrighty, so I'll finish up now, but if anyone is interested in participating, if they have an informal carer who may be interested, or if they'd like more information, please get in touch with me. My details are there on the left, and alternatively, you could go straight to our website. So that is the QR code for our website. I would also like to take a moment to acknowledge all of our partner organisations on the study. So we really appreciate all of the support that these organisations and hospitals give us, and also in allowing us to let people know more widely across Australia about this program and how we'd like to support people.